Did you know that your body sends critical warning signs 1 month or even just a few days before suffering a stroke? And understanding these signals could be the difference between life and serious disability or death. Strokes are undoubtedly one of the leading causes of death worldwide, and what makes them particularly dangerous is that while symptoms typically appear quickly, it can take hours or even days before a person realizes something is seriously wrong. A stroke is a medical emergency that occurs when blood from the heart fails to reach a region of the brain, depriving that area of oxygen and nutrients, which kills thousands of neurons every single second. Cardiovascular problems are becoming increasingly common around the world, particularly among younger people, and certain warning signs should never be ignored, no matter how minor they may seem. Many signals that appear a month in advance are subtle, and many people either neglect them or mistake them for something else entirely. The essential thing is that you know how to recognize these signs, because if you experience any of the symptoms presented in this video, you should consult a doctor as soon as possible, as they may indicate that a stroke is likely to occur. Today you will discover the 7 warning signs that your body gives you 1 month before a stroke, as well as how to prevent this disease and eliminate this formidable statistic. So make sure you stay with me until the end, because this information could save your life or the life of someone you love. The first sign is persistent high blood pressure, and if your blood pressure is not well regulated, you are at much higher risk of suffering a stroke. Blood pressure is the force that blood exerts on the walls of our arteries, and we talk about high blood pressure when this pressure is abnormally elevated. This elevated pressure can lead to the constriction, weakening, or rupture of blood vessels over time. When a blood vessel in the brain ruptures due to high blood pressure, hemorrhaging can occur, resulting in a hemorrhagic stroke. High blood pressure can also damage the arteries that carry blood to the brain, reducing blood flow and causing a blockage, which results in an ischemic stroke. This is why it is essential to know if you suffer from high blood pressure, and if so, how to treat it correctly. To control your blood pressure, modify your lifestyle, and take your medications as prescribed. This is essential to reduce the risk of strokes and other cardiovascular diseases. Before we continue with the remaining warning signs, if you're finding this information valuable, please take a moment to subscribe to the channel and hit that notification bell, because sharing this knowledge could literally help save lives. And your support helps us continue creating content that makes a real difference in people's health and well-being. The second sign is excessive fatigue. And exhaustion or excessive fatigue can be a symptom or warning sign of a stroke. Remember that fatigue can have various causes, but the lassitude caused by a stroke is strong and creates prolonged fatigue that can be debilitating for you and unrelated to physical activity or lack of sleep. For example, extreme lassitude can be caused by abnormalities in blood circulation in the brain. It may be due to arterial narrowing caused by atherosclerosis or a blood clot that disrupts the oxygen supply. Therefore, if you feel abnormally tired, consult a doctor to get properly examined, because extreme fatigue can sometimes precede a transient ischemic attack, often called a mini-stroke, which is a warning sign indicating that blood supply to the brain is temporarily compromised. A transient ischemic attack is a brief symptom that may indicate that a stroke is about to occur, and the effects are usually very transient, lasting from a few minutes to a few hours, and do not cause chronic brain damage in most cases. An artery in the brain is blocked, but within 24 hours the body dissolves the clot in the brain and the patient no longer shows symptoms. However, this is a strong indicator of the imminence of a stroke. The third sign is vision problems, and if you notice sudden changes in your vision, this could be a sign of a stroke. Blurred vision, double vision, eye problems, and difficulty concentrating can also indicate damage to the cerebral circulation. Vision loss may be due to an obstruction of one of the arteries that supply blood to the eye, and of course there are other causes of visual problems, but you should continue to investigate what is happening. The fourth sign is numbness or weakness in the extremities, and numbness or weakness of the extremities especially on one side of the body, can be a warning sign of a stroke. This rapid numbness or weakness usually affects one part of the body, such as an arm or leg, or one side of the face, and one side of the body may lose all sensation. These symptoms usually last a few minutes or a few hours, but they should never be neglected because even if it is not a stroke, it is important to evaluate any neurological problem. The fifth sign is speech problems, and a person about to suffer a stroke may suddenly experience difficulty speaking. Speech may be choppy, and the person may have trouble pronouncing words or forming complete sentences. And aphasia is defined as difficulty understanding, formulating, or expressing speech. The sixth sign is sudden and intense headache, and a sudden headache can precede a stroke. It is essential to remember that not all headaches are caused by a stroke, and not all strokes are preceded by a headache. But when they occur, they are significant. An ischemic stroke causes headaches because blood circulation to the brain is obstructed, and these pains are characterized by their intensity and suddenness. Hemorrhagic strokes, which occur when there is bleeding in the brain, are accompanied by severe headaches caused by the hemorrhaging, and this type of headache is commonly called the most painful. An intense headache can indicate that an aneurysm in the brain is about to rupture, and this is another element that must always be monitored. The seventh sign includes other neurological symptoms, and a person about to suffer a stroke, whether hemorrhagic or ischemic, may present other neurological symptoms. Warning signs can include memory disorders, loss of balance, nausea and vomiting. In other words, they can appear several days or weeks before the stroke. However, several other distinct diagnostic disorders produce similar symptoms, and these symptoms may be present in people suffering from epileptic seizures, hypoglycemia, encephalitis, brain tumors, panic attacks, or central nervous system disease. You must therefore always seek a good doctor to obtain a thorough examination because accurate diagnosis is crucial. You now understand that a disruption in blood circulation can put you on the brink of a stroke, and other risk factors for stroke include alcohol and drug abuse, obesity, poor diet, depression, anxiety, and sedentary lifestyle. All of these conditions stimulate particular processes in your body that can lead to a stroke, and in reality, strokes do not always present symptoms before they occur, which is why prevention is crucial. Control your blood pressure, maintain normal blood sugar, exercise regularly for at least 150 minutes per week, prioritize fresh and healthy foods, avoid processed foods, sweets, and excess saturated fat. Monitor your cholesterol levels and make regular appointments with your cardiologist, as these activities will help prevent strokes in the future. If you found this video useful, don't forget to like and subscribe to the channel. And you can also encourage other people to take care of their brain health by sharing this video, because this information truly has the power to save lives. Until next time, stay healthy and stay informed.